We use this time to meet to provide a little update, but really this time is for our VCO partners to come together, ask questions, get information. This is really time for you to ask questions of us and for us to provide answers. So we only have a small update today, and then we'll open it up for questions and answers. As a reminder, we do record these so that other people can see them that may not be able to make it. But we're going to go ahead and get started. So here are our short updates. Just as a reminder, on January 1st, the risk population became live. Remember, we were going to start back in July of 2021, but that got bumped and postponed. It's now it's live. That was just the just kidding portion. Now it's for real. We are going to go through the end of this year. It runs through December 31st, 2022 for this first year of this. Medicaid reported to us there was a glitch in some of their pediatric wellness eligibility files. And so people that were eligible for those wellness visits were actually being denied inappropriately. That has now been fixed. So if you had one of those issues, go ahead and resubmit that claim to Medicaid. It should be fixed. And going forward, that problem shouldn't happen anymore. And we wanted to give a update on Stellar. So the Medicaid population is now live in Stellar for groups that have one practice location. And for groups that have more than one, that should be ready by the end of January. Stellar is our platform that we use to help in proactive care. You know, last year, if you were introduced to Stellar, it was kind of a reactive type thing used after the fact. Now we really want to use this tool to proactively reach out to patients, schedule their exams, have information pulled up so that at the time of the visit, the provider has that information right in front of them as they do the visit. And if you have questions on how to do that, please reach out. Our teams can show you exactly how that tool works. It's a fantastic tool, especially for that proactive care, making sure that that visit is as much as can be accomplished in that visit is accomplished, that everything's ready to go and at the provider's fingertips during that visit. So reach out if possible. Any questions on those quick updates? I don't see hands. So, my current view. So if you want to just unmute and ask, that's great. And if not, we'll move on. Any questions? Okay. See, so Michelle Weiss is going to give us a care management update. Go ahead, Michelle.
Thanks, Ben. I think we have the last bullet on here. We're really getting close to our start date for care management, patient identification, and launch of our care management services. We're looking at the end of January, the first week of February. I think now we're pretty solidly on the first week of February, and maybe up to the 7th. So that's our target date to start proactively identifying patients that are utilizing the ED. And if somebody wants to advance the slide just a little bit, thanks. So what we're going to be doing early February, at least initially, is identifying those patients that have had 3 or more ED visits, avoidable ED visits, in a rolling 6-month period, and reaching out to those patients, kind of doing a complete assessment, trying to figure out, are there barriers, social determinants of barriers, transportation barriers? Do they understand clinic hours, how to advocate for themselves to get in? So working with them on redirecting that care back to you, back to primary care, where we all know they're going to be better served. We really work hard to help them identify urgent cares in their area or other options. But first and foremost, we really want those patients, to call the clinics. And some of that for us is helping them understand how to advocate for themselves. Maybe they're calling and asking for an appointment. Dr. Davis, I see you on the line. Maybe they're calling and asking for an appointment with Dr. Davis. And they're saying, that's great, we'll put you out in 3 weeks. And if the patient doesn't say anything or doesn't kind of explain their symptoms or what's going on, That might be the appointment they get. It might be even farther with all things COVID. So the patient takes it, hangs up the phone, and within 24 hours goes to the ED. And we see that happen. Patients think they don't want to bother their provider, or that was just what was given. So helping them understand how to advocate for themselves so that they're triaged appropriately. But our goal will really be to get those back to your clinic. We will do complete medication reconciliation, chronic condition education. And so if that's part of the problem, just understanding some of those signs and symptoms of exacerbation, if that's what's getting them to the ED. Maybe they're not understanding that if they picked up on that earlier, they could call the clinic, they could be seen, and it wouldn't be a full-blown exacerbation that would require ED or inpatient stay. Nutritional education, those are just a few of the things we have to offer. We have a respiratory therapist, social work, so we really can provide some pretty comprehensive support for those patients, and that's where we're looking at starting. Any questions? So you might start seeing outreach from us. As we outreach to your patients, we will notify you. We'll notify you if they decline. If we pick them up, we'll let you know what we're working on. So we will get that communication back to you. For some of you, that may be via fax. That's not our long-term solution, but for some, that may be the short-term solution. But we will let you know when we're working on your patients, and you might see that coming as soon as early February. All right, if we don't have any questions, Dr. Schott, I'll hand it off to you.
Thanks, Michelle. I think in terms of this slide, Ben, do you have anything specific to touch on? I think the intent is just to give you all some perspective as to where we as a VCO are sitting in the lives and the providers that we've got across the state. Anything else to touch on here, Ben?
No, that's exactly it. 65,000 of our kids of our people in our ACO or our VCO are under 18 years old. That's something that we wanted to throw out there. Otherwise, we'll go to this.
So I think just wrapping this thing up, going into this VCO and Medicaid population, there's obviously a significant emphasis on the pediatric population. For a lot of us over the last few years, at least here at St. Luke's Health Partners, we've emphasized the adult population and really proactively reaching out to our adults, both commercial and Medicare, to make sure that they're getting in for an annual wellness visit, with the idea being that as a provider, if I'm seeing a patient for an annual wellness visit, I can touch on some of those preventive issues, social issues, and not have to focus on multiple issues related to chronic disease and other things. The intent with this slide is to point out that there should be some commonality in terms of how we reach out to both our pediatric population and our adult population. The workflows and operationally within the clinics, we hope that there are ways that can be consistent across the age range. The other challenge, though, is that those items that are contained in the middle part of this diagram, those are components that we think apply across the age range. And as a provider, I can't address all those things on my own just walking into a room. And so to Ben's earlier comments, one of the goals that we have at St. Luke's Health Partners is making sure that, number one, we make sure that you are aware of who you're accountable for and which patients are really calling you their primary care provider. But then to the extent possible, make sure that you're aware of what those issues are. That there will still be things like making sure that on IRIS, those immunizations are current. There will still be some work to be done within clinics to make sure appropriate screenings are being implemented depending on the age range. The intent, though, is that moving into this Medicaid population and with kids, the core work is still proactively reaching out to patients, getting them in, and figuring out how we can get the right information to our providers and care teams so that they can make that visit as effective and efficient as possible. I hope that makes sense. And Donna Bergman, I think you're on the line. If you have anything to touch on there that I haven't, please chime in.
Nope. Well said, sir.
With that, I'll pass it back to you, Ben. Thanks.
Thanks, Dr. Schott. And with that, concludes what we have prepared. The rest of the time we wanted to leave open for questions that you all might have. We're here to answer them. So chime in if you have any questions.
I think one question, I'll throw out to the group, is this a good use of your time? Are there other pieces of information that we should be including in these updates that we're not? We don't want to pull you guys together. We know that everybody's incredibly busy, especially with the recent surge and stuff. We want to make this useful to you. If it's not, then we'll try to figure out a different format. So we're open to suggestions on that as well.
This is Kelly Miles with HCA. I'm just a quick question. First of all, I do think that these sessions are helpful. So thank you for doing these, and short and sweet is always nice. So, but how many lives are currently in the VCO, in the SLH and the St. Luke's lives?
Yeah, I can take that. There's approximately 90,000 lives in the VCO right now. Like I said, 65,000 of those are 18 years old or under. So we have quite a few children. But yeah, 90,000 lives is the total.
And Ms. Miles, just to add in on that, and Ben, correct me if I'm wrong, there are 11 VCOs across the state. We have within our VCO about 34% of the population. So we've got some pressure to make sure that we do this right. And that's on us to make sure that we're supporting you guys who are all actually providing the care. But we're the largest VCO in the state. There's a lot of accountability and pressure and eyes on us. So we've got to get this right, which is why really in my mind, making sure that we're communicating with you guys and that you're getting what you need from us, that's really important.
Yeah. It's also with the pandemic, the public health emergency, Medicaid is not doing what they normally would do to remove patients that are no longer eligible for Medicaid. Some of the eligibility requirements are waived during this public health emergency, and so our numbers are even more inflated than they would normally be once that goes away. So that 90,000 lives, it's a lot more work than maybe we had first anticipated, but it's ours, it's there. It may change once the public health emergency is lifted, when and if that happens soon. Great question. Other questions?
This is Corey Furin from Valor Health. I'll just chime in too. I think that these are useful and helpful to have these types of updates. Going forward, now that we're officially live with January 1st, will this be the forum where we'll see kind of general metrics and how we're performing as a VCO as a whole? Because I know we're going to have individual reports for the different entities. Is that correct? Am I thinking?
That was definitely the idea, the intention. Angelica, you have anything to add?
Yeah, we can definitely, if that's a point of feedback you'd like here to look at the overall VCO performance, we can certainly bring that here with some routine. We do not have current performance year data reported to us by the state yet, so it might be a few months before we have something meaningful to share there. But we can share historical performance at the next office hours, just to give you a sense of the general challenges maybe we perhaps face together. The primary highlight I would call out is that during the pandemic, we saw a pretty significant drop in breast cancer screening and in diabetes A1C testing. So if you have adult Medicaid patients, those would be probably the two main areas I would look first from a general kind of care gap perspective. And then in the context of this conversation today, we also saw the 0 to 15-month well child visit rate drop off. And so again, proactive access to care is going to be probably a lot of what we talk about this year, and how we help you all succeed in creating access to care, kind of despite all of the challenges I think everyone's facing with acute visits right now. So if there's feedback on that or ways we can support, that's what we want to hear from you all. And then again, Stellar Health provides a prioritized way to do that outreach based on risk factors, chronic disease burden, including in kids, and then ED utilization. So we're looking for your feedback on that. And then groups with more than one location. Again, we're hoping to get confirmation, but the 31st is when you can expect to see kind of the scale type.
Thanks.
Other questions?
If there are other items like that anyone else feels like we need to include in these meetings going forward, please let us know. The other thing is that we really want this to be bi-directional. You guys are all leaders in your communities. Many of you have leadership positions at the state level as well. So if you're hearing things that you feel like we need to be aware of, either within your community or your practice or at the state level, please let us know as well.
Hi, this is Gina with Central District Health. Thanks. First time I've been able to make it, and so I think they're valuable so far based on the first 17 minutes. My question is, we would at some point hope to include our providers in some of this dialogue, and they have the general kind of peripheral understanding. Is that a planned activity that could be here that people could kind of get that overview from a provider perspective, or should we reach out to kind of our contact, Kim, I see Kim here, and have kind of that offline of this forum?
Kim, you want to take that one?
Sure. I think we're open to any and all ideas. We have some, some thoughts about what we're going to move forward with in the future, but things like provider panels where we have providers actually coming together to do, to share their learnings as they work with this population. Also, educational opportunities as it relates to, what have we learned caring for this population? It's a unique population. There are unique ways to care for them. There are things that we can do to be successful in caring for this population that may be different from other populations. And then also as it relates to pediatric care, just recognizing that's the bulk of our patient population, the VCO. But any and all ideas, we're kicking off 2022 and really open to what would be most valuable to you. So thanks, Gina, for that feedback. So yeah, let us know.
And Gina, I think Kimberly and I and all the pop health directors, we look for opportunities to meet with providers. I think that a lot of the orientation, we want to know what's going on in your practice. There's not a rubber stamp approach to this. Each practice is going to be a little bit uniquely different. So planning that conversation just to get people oriented, I think that needs to occur with them directly. I think to Kim's point, having those webinars where we link people who have done well. A lot of you guys have been doing this for quite a while. So what can we learn from each other, and how can we connect clinics that are facing similar challenges that may have a good solution? It's just a matter of kind of spreading the wealth. That's our intent as well. So there's multiple ways to do that. And we're, as Kimberly said, we're certainly open to other suggestions going forward. But if you feel like we need to make a visit, then just give Kimberly a note, give her a call, and we'll make that happen.
Awesome. Thanks so much, you guys.
And I would jump on with that same thought. This is your meeting. If there's a topic you want to hear, you're dying to hear, and you want to hear it at the next meeting, send it to us and we'll include it. We'll have a short update every time, but the rest of it is completely open for suggestions, and we'd love to have it beforehand so that we can have stuff prepared to share with, get the people that you want on to hear it. That'd be great. So reach out to any of us if you have suggestions for upcoming topics you just need more information on. Other questions?
Hey, Ben, just maybe wrapping this up, the consistent feedback we're getting from all the clinics that we talk to is you all are getting absolutely hammered with Omicron. We know it's hitting your staff. We know your volumes are high. If there are things that we can do just to help support you, even if it's just a matter of having somebody to scream at, don't hesitate to give us a call, because we know you're all working overtime. We really appreciate the work you're doing. Your hearts are out there and you're working your tails off. So thanks for doing that stuff. Don't hesitate to give us a call or shoot us a note anytime.
And with that, if there's nothing else, we can give you some time back. I appreciate you showing up today. Thank you, everybody. Great meeting.
Thank you.
Thanks, everyone.
Thank you.
Thank you.
Thank you.
I had 3 days off. Yeah. And like when we had that big snow again, I think we were off work for like a week then or something. So yeah. Unless your internet's out, there's no reason you shouldn't be working. I mean, it's not in today's environment, right? Yeah, agreed.
Hey, Ann, I got on.
I think Celeste is joining. I know that when Anne Marie left, she made sure that I was introduced to Celeste, and so we've got her going on one of our portals, and so she and I are going to get together, I think tomorrow, so I can kind of walk her through the portal. That way she'll have a way to view the population with the 310. We can get a head start on education appearance gaps and things like that. So hopefully that'll be positive, and I'm going to walk her through that process. Okay. Well, it looks like Kelly has joined.
Yep. Hello. Can you guys hear me? Can you hear me, Ann?
I think I see that you. Are you on yet?
I guess you cannot hear me.
Yeah. Well, and I see Kelly's on, but she didn't. I mean, I don't hear her. Let me see if. Let me look and see if I can get actual meeting invite. Okay, let me put this down here. Copy. And you guys, I don't know why Teams does this. I swear sometimes it seems like it works, and then sometimes it doesn't. And did you have any issues? Did you have any issues when you tried to get in? No. I know it worked. Okay, I put the meeting info in the chat. So hopefully it works for everybody. And I'm sorry if there was